I hope you're having a great day so far today. I want to talk today specifically about perimenopause. This is just it's a really busy word right now, perimenopause is, and it's confusing. And I actually got an email from a patient or a follower just yesterday, actually, and she had had a partial hysterectomy. So she still had one ovary. And she was like, my biggest problem is that I don't even know where I am in perimenopause. And to be honest with you, she obviously doesn't have the period aspect of things to know that. But truly, so many people that even have a period are unsure where they are in sort of like this transition. So first, let's go ahead and define what is perimenopause. So perimenopause is defined as literally 2 to 12 years before menopause. And I know that's a huge range, but everyone's a little bit different in this aspect of when they're going to start this. And it's just the transition of where our ovaries start to be less responsive. And when this happens, obviously hormones shift and change, specifically estrogen and progesterone. And from there, that can create a lot of different symptoms. So let's go ahead and get into what this means. So the importance of understanding perimenopause is that because of this hormonal fluctuations and things shifting, we tend to experience a lot of symptoms, and the sort of like way we experience perimenopause, the symptoms that we have to some extent can also dictate how our future health goes too. So things like in our 60s, 70s, 80s, and hopefully longer of our lifespan, does that include cardiovascular disease or osteoporosis, osteopenia, or dementia and Alzheimer's, or metabolic disease? Hormones matter for a lot of those things, cognitive functioning, focus. And so we're starting to understand that as a society, these hormones that we have, these sex hormones, which Kelly Casperson is an amazing woman on social media. She's a urologist, but has really been such a pioneer in talking about women's health and hormones and HRT and all of these other topics, has said that, these hormones are far more than just for periods, and therefore should be like remarketed, basically, like saying, sex hormones are an outdated terminology. They're not just for sex related things and reproduction. They actually have systemic effects in our heart, in our bones, in our brains, etc. And therefore should be getting a lot more attention than they are currently getting. So when we go through perimenopause, probably most of us know this, if you're anywhere between your mid to late 30s through your 50s, it really does have an impact on your physical, mental, and emotional health. Physical, meaning that our periods are changing, insomnia, heavy periods, clotty periods, PMS symptoms, breast tenderness, fatigue, migraines, polyps, fibroids, cysts, fibrocystic breasts, like all of these things that women deal with can be due to hormonal fluctuations. Mental, emotional health, things like I mentioned, cognitive functioning, brain fog, memory, and word recall are due to some extent either testosterone, progesterone, or estrogen. Emotional health, progesterone plays a huge role in this, as does estrogen too, but we can experience worsening of things like anxiety or OCD or depression, irritability, frustration, rage. All of these symptoms can be due to hormones. And so I want to go through today and talk about kind of the stages of perimenopause, because I think that it's hard because it's a transition, right? It's a transition from normal menstrual cycles to your ovaries slowly but surely over time stop the responsiveness that they used to have, like in our 20s and early 30s, for example. And so because of that, there's not a diagnostic test that will say, yes, you're in perimenopause now. Now, with that said, sure, we can start to look, progesterone starts to get a little bit lower, your estrogen fluctuates, but that can be one of the reasons that it's so hard to test, is because what your hormones are today, for example, is not what they're going to be in 2 days or next week or in 2 weeks, right? That is normal in any menstrual cycle, not just perimenopause, but in perimenopause, the fluctuations in a menstruating woman or a woman that has ovaries is going to be a lot of fluctuations, right? So even if you don't have that period, but you're still within the reproductive age and your ovaries are still cycling to some extent, you're still cycling and experiencing hormonal fluctuations. So, early menopause, let's talk about that first. Early menopause typically begins in the 30s to early 40s. And this can last a really long time before more of like the more prominent symptoms start to pop up. So, we typically think of perimenopause as kind of like, oh, maybe I'm getting like a really irregular cycle. Maybe I'm noticing like hot flashes or night sweats or things like that. My periods are, coming 60 days or 90 days apart, things like that. That is the end stage of perimenopause, but a lot goes on before we get to that stage. So in early perimenopause, it can be your cycles just slowly start to change a little bit. And because I do this for a living, am like overly aware of my body, which sometimes is a curse for sure. It's not even like a bit of a curse, it's a curse because I'm like very hyper aware of everything. And so perimenopause for me has looked like a slight increase of breast tenderness again. Like I didn't have that since I was a teenager, and I started to notice like, oh, interesting, this thing is back. It can look like your cycles just change. So maybe like spotting. And again, you should have these things checked out if you're concerned about them. So spotting can also be things like polyps and cysts, or, other medical things or structural things that need to be diagnosed at least. And they can grow due to hormonal imbalances too. So that, like I mentioned, you can start to grow fibroids and cysts and polyps and things like that due to estrogen fluctuating with progesterone. But you want to make sure that you're getting the diagnosis right and there's not something pressing. So before I go any further, let's have that caveat of please work with a medical professional, practitioner, somebody who can help you actually diagnose these things and make sure that what you're experiencing is just typical perimenopause. But a lot of women, for the most part, these things are definitely perimenopause. And so you may notice that, like, it used to be a 30-day cycle, for example, and now maybe it is a 28 or 27-day cycle, and you spot, or your blood is a little bit different. Maybe it got a little bit heavier than you were used to. Maybe you're bleeding a little bit longer. So you used to bleed, for 3 or 4 or 5 days, and now it's like that full 7 or 8 days. You're just going to start to notice these really subtle symptoms of your menstrual cycle. Maybe your PMS is worse. You're starting to get a lot more like moodiness before your period, or diarrhea, or different cramping. Again, all of these things can be part of like the early stages of perimenopause and probably last a really long time, right? So in my opinion, if you notice that your cycle is changing, and I typically say for my patients, like more than one time. So we know the endocrine system is just incredibly sensitive to viruses and illnesses and injuries and travel and stress and differences in exercise or food, or, time changing, like I said, travel. Our endocrine system is sensitive to all of these things. So if it's one time where you're like, wow, that was a really weird cycle for me, probably fine to just kind of do a watchful waiting type of a thing and then look at next cycle. If you start to notice it, and you can maybe like look back and be like, oh, I was really stressed, or my food or my workouts changed, or I traveled on this international trip, or I got COVID or something like that, then, watchful waiting. If it happens again, the second cycle, again, let's assess your lifestyle. Let's see what's actually going on, why this might be happening, what the symptoms are that could be contributing, or what your symptoms are and what lifestyle factors could be contributing to this. And this is where the work of an experienced practitioner like myself can come into play. If it happens twice, likely it's something to be treated. And maybe that's just supplements and herbs. If you are more stressed and it's starting to impact your menstrual cycle, that is where my body likes to gravitate. I definitely know when I'm stressed that my period changes a bit and does some different things. Maybe that's just adding some adaptogens so that your body handles stress, is more resilient to it, and your body can handle more exposure to cortisol without it kind of wreaking such havoc. Maybe that's getting on something like a feminescence maca root for menstrual harmony or perimenopause if you're feeling hot. Maybe that is doing some hormonal testing. Maybe that is adding some omega-3s for inflammation. Maybe that's looking at your nutrition and changing up your diet a little bit. More exercise, maybe you're under or over exercising. So I think that after 2 cycles of it being different, in my opinion, in these early stages of perimenopause, it is absolutely 1,000,000% worth it to get on top of it, because these things just definitely tend to sort of build on each other and exacerbate. And as a woman, I totally understand sort of the barriers to entry of not wanting to treat it, just kind of hoping it goes back to normal. Like, oh my gosh, I've never dealt with this, and it's just like this weird thing. But because it only happens monthly or so with a period, we tend to, forget about it for 3-4 weeks, and then it comes back and we're like, oh, there's that thing again. And it takes us a while to actually want to treat it. But from my opinion, it is 1,000,000% worth it to, in the early stages of perimenopause, when you notice it, and even prior to that, for all of you who are younger than this, even get yourself under control, get your hormones in a good place, get your lifestyle in a good place. This matters so significantly for how you're going to go through perimenopause. Yes, genetics play a role. Yes, some other things play a role in that too, gynecological history and all of that, but lifestyle plays a huge, huge role in what the next decade always looks like. Even if you're in your 50s, that dictates what your 60s are going to look like. If you're in your 30s, that dictates a lot of what your 40s are going to look like. So if you're noticing changes, realize that, like, while it is just typical perimenopause, it's not something that we have to deal with. Specifically in those early stages, we can really help the body manipulate that a lot and make sure that your cycle is regular, your menstrual flow is normal, your symptoms are managed, you're not having a lot of PMS or cramping or painful cycles or nausea or migraines or any of these things that we tend to deal with, that we kind of have just been gaslighted to think is, air quote, normal, right? Like, you might, we're really talking so much about more women's health stuff now, and the cat's kind of getting out of the bag, and most women realize this. I wouldn't say most, actually. I have to roll back on that. A lot of women know that these things are abnormal. There's things you can do, but there is still, so much work to be done here. And it depends on the demographic of woman that you're talking about, right? Or talking to about this thing. And so we have so much more work to do here, and there's so much you can do for these symptoms. You absolutely do not have to deal with them. Typically in this stage of perimenopause, the treatment from your maybe OBGYN is going to be birth control. And I talk about this with patients literally every single day, because they've gone to their yearly exam or they've chatted with a doctor before coming to me, or whatever the case may be. I'm always a fan of working with your OBGYN or medical provider. I think like that intersection between sort of somebody who can look at you holistically and, to be honest, spend the time with you. Western doctors, just the way that our entire medical system is set up, don't have the time to ask you about your nutrition and don't have the time to ask you about your stress and how to manage that. And it takes me at least 50 minutes with a new patient to really get all of these things done. And that's just not how it's set up. And so I think, the best outcome for patients is to have somebody who can do that for you and really help you and guide you, especially in this perimenopause, menopause transition, because things change frequently. It's not just like one thing, kind of like in our 20s when we had like this one symptom and we treated it, we kind of knew what to do about that thing. But now things are shifting so much that, once we kind of maybe figure out like we got something under control, there's the potential that things might shift again. All is normal and there's nothing wrong with you. So I'm a big fan of having a multifaceted kind of care approach to this, where we, keep open communication with our Western doctors. We have somebody who thinks of things more holistically or alternatively, functionally, all of those different things. But if you are in this stage, please treat it. You will be so happy that you did, to get this estrogen, progesterone specifically under control, your diet in a way that we eat for healthy hormones, our strength training, our movement, our emotional and mental health, all of these things in a good place, including our nervous system. It will absolutely help you with what's to come, for sure. Tracking your periods at this stage is super helpful too for someone like myself to be like, okay, objectively, it is, going from a 30-day cycle to a 28, and then it went to 27 and then 26. And it's also getting heavier. You're changing X amount of tampons now, or menstrual cups or whatever. The more objective data we have is helpful for, learning really what's going on, and kind of noting these changes. And just remember that your estrogen at this stage, contrary to what we think of estrogen in perimenopause as just sort of linearly like decreasing and going down with progesterone. Estrogen actually goes on this amazingly huge roller coaster. It's saying, some months it's higher, some months it's lower, and it fluctuates within your menstrual cycle as well. So things can look pretty different. Even cycle to cycle sometimes. And that is true specifically more in mid-perimenopause, in my opinion, which is kind of like this mid to late 40s thing. So keep in mind that the average age of menopause in the US is 51. So anywhere from late 40s through mid 50s typically is when women go through menopause. And like I said, you just in these stages, just really want to keep open communication with your provider, someone like myself, your OBGYN, your primary care provider, even your endocrinologist, whatever you have. You just want to stay, make sure they're staying very evidence-based, and you want to make sure that they know what's going on. So in mid-perimenopause, this is more, like I mentioned, kind of that mid to late 40s, where there's going to be more pronounced changes in symptoms. So we may start to notice a little bit of warmth coming through. So a little bit of like hot flashes or night sweats. We may notice a little bit of vaginal dryness occasionally. Our cycles are more irregular. So some of my patients, and again, this isn't everyone, some women go through this and don't even really realize that they're going through it. And I will give the caveat on that research has shown that all women have some symptoms of this. Some of us are better at ignoring them or just thinking that they're what we have to deal with. And so they just don't talk about it or make a big deal about it. Whereas other women obviously experience more severe symptoms, more debilitating, more life-altering. It really is kind of all over the board, but everyone's going to experience something about this. And so, like I said, in this kind of mid-perimenopause, more shifts in hormones where it might look like you are experiencing, a cycle every 18 days, and then it goes to 60 days, and then it's at 24, and then it's at 30. It's kind of bouncing all over the place. And basically what's happening here is our brain is the control center for every single thing in our body. And that's true with our menstrual cycle and our hormones as well, from the hypothalamus and the pituitary gland. And so that hypothalamus pituitary used to have like a really super highway from your brain to your ovaries. And it was just all working so well and fluid, and everything was in great communication. As we start to get into this perimenopause and postmenopause, or late stage of perimenopause, your ovaries become less responsive, right? They're kind of just like tired, we're kind of done here, we're running out of our follicles, all of those things. And so your brain sends follicle stimulating hormone down to your ovaries, for example, for ovulation, and is like knocking on the door. And sometimes your ovaries don't answer the door. And so your brain sends more down there to knock a little bit harder. And occasionally it will like douse your whole body with a whole bunch of estrogen. And that'll look like, this short, heavy, crampy, clotty cycle. Or it'll just kind of like spit out a little bit of it so that you can have a period after, 60 days or so. And so that's where this hormonal fluctuation happens, and why we feel sometimes like we're hot and dry, and sometimes like we are having breast tenderness and heavy cycles and cramping and PMS and all those things. It's because your estrogen's up and down. This is one reason that doctors struggle with testing hormones sometimes, and a lot just decide not to, because what it is today is not what it's going to be tomorrow necessarily, or in a week or 2 weeks, like I mentioned before. So a lot of practitioners, which I don't buy into this approach, but a lot of practitioners are like, it doesn't matter because there's all over the place. However, I think specifically in early and mid perimenopause, when you are really symptomatic, specifically looking at your estrogen and progesterone 5 to 7 days after ovulation, if you're ovulating, is really helpful. So if you're somebody who had that partial hysterectomy and don't have a period, or you had an ablation and you don't have a period anymore, but you still have ovaries that are still functioning, you're going to have to test for ovulation if you want accurate data here. We can also, again, look at some of the subjective data on symptoms and things like that. That could be really helpful in guiding us to what is kind of going on. Do we need to detox your estrogen, support progesterone? Do you have low estrogen that we need to support? Are you ready for HRT, which tends to happen in the very last stage of perimenopause into postmenopause? HRT for more mid perimenopause and earlier stages tends to be progesterone support, and or even testosterone support is fine. But estrogen, I like to tell people to wait, obviously, until it's low consistently. That's a better time to add in estrogen when you're experiencing those symptoms consistently of hot and dry. So hot flashes, night sweats, vaginal dryness. You're noticing genitourinary symptom like urgency, frequency, painful intercourse, your skin and nails and hair and eyes are getting dry. You might be feeling more achiness, things like that. There's a lot of symptoms of low estrogen in late perimenopause, and those are a few that you might notice. So again, with this whole perimenopause thing, there's these different stages, and the treatment at all of these stages is definitely different. We tend to hear on social media right now, like, for perimenopause, HRT is the magic answer right now. Like, everyone's talking about it, and I am very pro HRT, but it's a nuanced conversation and we have to break that down. So HRT is anything from insulin to thyroid hormones to estrogen, progesterone, testosterone, any sort of hormone replacement therapy. When we're talking about this, we call it menopause hormone therapy, which tends to be estrogen, progesterone, and testosterone. So even within those three menopause hormone replacement therapies, it depends on what symptoms you're experiencing and where your hormones truly are. You would never, like I mentioned, add estrogen to somebody who's going through early perimenopause. You would feel miserable. You'd have so much estrogen, you'd be gaining weight, your face would be puffy, your breasts would be swollen, you'd be having really heavy periods. Like, that would not be appropriate, but it's absolutely appropriate in the right candidates of women who are actually having consistent low estrogen, if that makes sense. So that's what you're going to notice more in like the mid stages, is like a lot of like mood swings, irritability, maybe some changes in libido, although libido is a very nuanced conversation and can occur literally at any age that we have, from stress and other aspects of it. It's not just low testosterone that causes a change in libido. We might be noticing, like I mentioned, in this mid stage, hot flashes, night sweats. You might be noticing worsening PMS symptoms or just changing PMS symptoms as well. And that is huge because our estrogen and progesterone are fluctuating. Like I mentioned, some months and some days estrogen's high and low, and your progesterone is just kind of slowly decreasing, right? So progesterone, think about it as like progestation. It occurs from ovulation to the start of your period. And in this stage of perimenopause, your ovaries are less responsive, meaning that the chance of pregnancy and gestation is less. And so your progesterone is also going to be lower. Progesterone is that hormone that really opposes and keeps in check your estrogen. And so really what we think about in mid-perimenopause is unopposed estrogen, which means estrogen is kind of running the show, doing whatever it wants to. It's kind of like your crazy aunt. And progesterone, the parent, is not there to keep it in check. And so we want to, support progesterone in this phase of life, either through something like Vitex or chaste tree berry. That can be really helpful. Through vitamin E can be helpful, borage oil, or, even using something like a maca root can be helpful, or even using, like I said, like some actual progesterone, either over the counter. There is some in lower doses, and some of the sources are coming from wild yam, or you can ask your doctor for something like an oral micronized progesterone, and that can be really helpful too. So lots of support in this stage. Also dietary changes, just really making sure that you're getting in your micronutrients, you're supporting your insulin, your cortisol, your adrenaline through eating good protein, good fiber. Your exercise is good. You're moving enough, but not too much, which I know is such a nuanced thing for everybody. And that can look different, but truly at this stage, it's really about listening to your body. How do you feel good moving? I'm a big fan of strength training or some resistance training because it helps us metabolically. It helps us produce human growth hormone, which is anti-aging. It helps us with insulin and blood sugar and muscle mass and prevent against metabolic diseases. Super helpful, but that can look different for everybody. Maybe Olympic style lifting is not what feels good on your joints or not something that you have the time or the capacity to do. Any sort of resistance training is going to be helpful. And so I think, just really focusing on some of these other, like even non-hormonal lifestyle factors is critical at this point too. You're also at this stage and you're also going to want to do just, your regular health checkups and screening. So your breast health checkups. There's really, as a small side note, there's a really exciting company called QT Screening, which is a brand new form of breast health screening for cancer. It can be diagnostic. It's actually much safer than a mammogram, and it is through a radiation standpoint. I'm still a fan of getting mammograms. Don't stop getting your mammograms. But this new technology is coming out in different states right now. It still has, room to grow for sure. But it's called QT screening, and it is no radiation, and it has better imaging of breast tissue. So going to be really exciting for that. And I just want to say to you guys, like, we are in such a great time for women's health right now with so many people pioneering this like new wave of women's health. Like, we're going to get this done. We're going to help women from now on, from all of us on the ground doing it, talking about it, helping new technology, so many great things. We are going to get this done and help women and prevent diseases and cancers and misery and all of these things. We're gonna figure it out. So I'm hopeful, like so hopeful for all of us in this era, where I think our moms, like the women in like their about 60s and 70s right now, have really had a rough go at it, due to a couple studies that came out about HRT and just how we viewed women's health and the lack of information, the lack of knowledge. They really had a rough go at it. And I'm very, very hopeful that us in our early and mid stages of perimenopause and even late stages, you don't have to suffer anymore. Like, we're getting this right now. So make sure, checking your blood lipids, your insulin for insulin resistance, your A1C levels, your C-reactive proteins, your metabolic health panel, your blood counts. Like, let's look at these things consistently, and let's do a good job at keeping our screenings going so that we can, do preventative medicine too. And then late perimenopause is late 40s to early 50s. So this is the stage where we are approaching that final menstrual period, and menopause is one day where you have gone 1 year without a period, and then from then on you are postmenopausal. So in this stage, generally we're looking at low estrogen levels for the most part. It's, still fluctuating somewhat, but definitely getting lower. Continued hot flashes, night sweats, mood changes, some vaginal dryness stuff like the genitourinary symptoms can be prevalent here, changes in sexual functioning. I'm making it sound really scary. Again, there is help. There's so much we can do for this. Please don't feel like you need to just deal with all of these things. You are still having a period, often longer gaps between those periods now. They might be a little bit different and longer. You might get like some weird spotting occasionally and then nothing. All of that stuff is normal. And we really just want to be in this point, assessing the risk of our bone health and osteoporosis, because that's a big thing. We don't want to break our bones and have fractures as we age. So mineral dense foods, your fruits and vegetables for sure. Vitamin D is a really helpful imperative bone health nutrient. Magnesium also, as well as your calcium, of course, but there are other nutrients that we don't talk about sometimes. resistance training and walking at this stage, guys, we use it or lose it. And what that helps, that occurs with fitness and mobility and all of those things. So it's important to look at your fitness as, squatting and like functional fitness, like getting up and off the toilet. I know we've all seen people who, as they age, are unable to do a lot of these things, stairs, getting up and down, getting up and off the floor, using our abs. That's all important stuff to maintain normal functioning of our entire body so that we have a good quality of life and we can continue to do the things that we want to be doing. So I think that that's an important consideration here. I also think, maybe getting a calcium score or really getting a deep lipid panel to assess your cardiovascular health, because that can change with low estrogen. And again, maybe especially in the late stages of perimenopause, assessing your candidacy for hormone replacement therapy. I'm a fan of like a transdermal type of delivery method. So creams and patches of your testosterone and your estrogen. And then, looking at progesterone, you can do topical, you can do oral micronized progesterone. If you want to, you can do herbs and supplements as well. You do not have to do HRT if you don't want to, but being open to it, because it is a lot safer than we previously kind of associated with it. I think people that have a history of migraines, people that have a history of blood clotting disorders, breast cancer, certain gynecological cancers, it's not completely off the table, but it is still a nuanced conversation of determining delivery method, dosing, your risk benefit analysis of things, and talking to a practitioner who is evidence-based and up to date on the newest research is absolutely imperative, because there was a whole health study that came out in 2002 that really scared people away from HRT, and it still lives within a lot of practitioners out there. And so we really, have debunked a lot of that. There's a lot of new research. There's a lot of really exciting stuff around it. And so you want to work with somebody who's super up to date in the information with that. But I'm pro HRT, but I'm also pro everything else too. I'm pro herbs, I'm pro lifestyle, I'm pro nervous system regulation, I'm pro nutrition and strength training. HRT is never going to be a magic bullet for anybody. It can be really helpful for some people, and some of my patients, to be honest, don't notice much at all. They try it and they're like, yeah, I didn't like it. Some people had adverse effects of it. It's a medication. It's just like everything else out there on the market. Some people do great. Some people don't like it. Some people kind of feel a little bit more indifferent to it. And so, I think just looking at the hormonal options, the non-hormonal treatments, and really getting conducive, kind of collective lifestyle plan going to determine, like, familial history, what risk factors do you have? What do we need to specifically be concerned about with you? What are your goals? What are your own health history concerns? All of those things are imperative at looking at kind of like this transition through perimenopause. But moral of the story here that I really wanted to bring home before we wrap up is you don't have to suffer, number one. And the sooner in your life in general that you start to address what's truly going on, you will fare better. So if you're in your early 30s, even right now, and you're like, I'm just not feeling good, I just had a baby and things are really off, get it under control. Let's work on it. Let's get your hormones back to being balanced after you go through that. Because the thing is that happens is we go through like this reproductive age in our 20s and 30s for most women. And, you are pregnant, you go through kind of like the fertility thing, and then you get pregnant, and then you're postpartum. Your hormones are off for years sometimes, specifically if you're breastfeeding. And then, if you do it subsequent times with multiple kids, then we're butting right up to perimenopause. And there's a lot of my patients, a lot of women in general, that, are in perimenopause and get pregnant totally fine and nothing to steer clear of, for sure. It's very safe and totally fine. But when that happens, we're just sort of like mixing certain transitions, right? So like you might end your breastfeeding journey and then go straight into perimenopause. And it's sometimes difficult to know, like, oh my gosh, is this hormonal stuff because I was pregnant for 9 months and then breastfed for a year. And now we're almost looking at 2 years of having weird hormones. And now my stuff's out of whack. Or is it because I'm 38 years old and this has happened and now this is perimenopause? The moral of the story, especially in that early stage, you guys, I don't get too bogged down with, oh yeah, this is exactly perimenopause, or this is due to postpartum, or this is, on another realm, like this is adrenal fatigue. I just get bogged down in like, I don't care what we call it. Let's just fix it. Let's just get in there, understand the changes that can happen during pregnancy, during postpartum, during perimenopause. What stage of perimenopause are you in? What are, effective and evidence-based treatment principles for those different stages of perimenopause? And let's just get things balanced, feeling good, get your blood work looking better. And that's really the name of the game. So I think, like I mentioned, just at any stage of the game that you're at, it doesn't matter what we're calling it. If it's too early for perimenopause, but we feel miserable, like let's get in there and get it fixed anyways. And that'll help you fare better when those hormones and that physiological process of your ovaries stop responding. That'll help that process just end up being better for you as a whole. So I hope this was helpful for you guys. I have tons and tons of resources all on this. I have, obviously the podcast, the YouTube channel. I'm recording this on both currently for all the different learning styles and entertainment styles. I have free resources that are in all the descriptions, both on the podcast and the YouTube channel. I offer free discovery calls where we can chat about, your needs, how I can best support those needs and help you through that. I have digital courses. I have my Instagram. So there's no shortage of information here. When you're gathering information about this, I will give you a small caveat here. Please make sure the person knows what they're talking about. There's perimenopause now is really buzzy, as nervous system dysregulation is, and insulin resistance and cortisol in general. All these things are really popular right now. We're starting to, again, get the cat out of the bag, which is so great. Such a wonderful thing to talk about this. But with that becomes some sort of like oversimplification sometimes, or misinformation, or confusing, conflicting over or information, or confusion in general. And it doesn't need to be like that. If you're working with somebody who knows what they're doing, they'll make it simple for you and tell you exactly what to do in a way that will fit your lifestyle so that you can move on. You don't need to do the simple, or the complex, the hard, the time consuming, the overwhelming, the expensive things out there. There's so much help for you beyond that. So I just wanted to end with that today. And I hope this was helpful. Please share with people who are going through any sort of hormonal stuff. Like I said, 30s, 40s, 50s, we got you covered over here. And I just really want to get this information out so women can be educated and stop being so confused, or worse, just kind of throwing in the towel here and being like, I don't know what this is. My doctor doesn't know, they're ignoring me. Which honestly, as a side note, you guys, I read a research article the other day that shared it can take up to 10 doctor's visits, GP visits, to be diagnosed with menopause. Like, that's abhorrent, because everyone knows that we're going through this. It's not like a disease, right? That maybe you have, maybe you don't. Like, we're going through this, whether we want to or not. And so I feel like that's crazy, but it's because there's not standardized testing for it necessarily, especially in the perimenopause journey. And there's not a uniformity of symptoms, right? Everyone experiences this slightly different. And so that's what makes it difficult for, doctors with a 15-minute time window to talk to you about this. And fatigue and joint pain and insomnia and anxiety and hot flashes can look like a multitude of different things. So I understand, but we're doing better. We're going to do better. And this is the first step by just talking about it. So I hope you guys have a great rest of your day, and I'll be back next week.